Brain cancer is a disease of the brain in which cancer cells arise in the brain tissue. Cancer cells grow to form a mass of the cancer tissue that interferes with brain functions such as muscle control, sensation, memory, and other body functions. Cancer cells that develop from brain tissue are called primary brain tumors, while cancer that spreads from other body parts to the brain are called metastatic or secondary brain tumors. Treatment for this cancer isn't very different from most cancers. Chemotherapy and other popular treatments are used for brain cancer. Statistics suggest that brain cancer occurs infrequently, is likely to develop in about 22,850 new people per year, with about 15,320 deaths, as estimated by the National Cancer Society and the American Cancer Society.
Breast cancer is a cause of mutation in the breast tissue. A person wouldn't get breast cancer until adulthood. A first sign are breast lumps or abnormal growth. In its early stages, breast cancer usually has no symptoms. Some other signs of breast cancer are a skin nipple lump, change in how the nipple looks. Some healthy choices to prevent cancer is to eat well and exercise. If a person has cancer, they want to get it found as soon as possible. Breast cancer can affect a person by their hair being lost, always in pain, diarrhea, throwing up, and radiation.
Lung cancer is the most common cancer in both men and women in the U.S. In 1987, it surpassed breast cancer to become the leading cause of cancer deaths in women. An estimated 158,040 Americans are expected to die from lung cancer in 2015, accounting for approximately 27% of all cancer deaths. The number of deaths caused by lung cancer has increased by 3.5% between 1999 and 2012, from 152,156 to 157,499. The number of deaths among men has stopped rising, but the number is still rising among women. In 2012, there were 86,740 deaths due to lung cancer in men and 70,759 in women. The age-adjusted death rate for lung cancer is higher for men, 56.1 per 100,000 persons, than for women, 36.4 per 100,000 persons.
Skin cancers involve abnormal cell changes in the outer layer of skin. It's known as the most common cancer in the world, accounting for 75% of all cancer diagnoses. Skin cancer is rising. Most cases could be prevented by limiting the skin's exposure to radiation. Skin cancer is more known in men than women. The risk increases by age. Most people are diagnosed are between ages 45 and 54. Skin cancers fall into two categories: melanoma and non-melanoma. Melanoma is more aggressive, it can be treated early, and the risk of being badly ill can go down. Non-melanoma is as threatening. They progress slowly. Skin cancer tends to strike people that have a light skin tone.
After skin cancer, prostate cancer is the most common cancer among males. Thankfully, it can be treated successfully. Prostate cancer is an exocrine gland in the male reproductive system. It is under the bladder. The prostate gland has epithelial cells which produce a protein called PSA, which is prostate-specific antigen. The PSA helps to keep the semen in the liquid state. The prostate cancer starts in the gland cells, which is called endocarcinoma.
Liver cancer is, of course, a type of cancer that resides in the liver. This type of cancer strikes twice as many men than women at an average age of 67. Some ways people can get liver cancer is from a birth defect, alcohol abuse, and hepatitis B or C. Liver cancer can be linked to obesity and fatty liver disease. Some ways to avoid liver cancer is don't drink a lot of alcohol, but in my opinion, don't drink alcohol at all. Also, practice abstinence and safe sex. If you have liver cancer or any type of cancer, don't think all is lost. Live life to the fullest.